Hello everyone, I'm going to talk about timing of endoscopy for acute upper gastrointestinal bleeding. Definition. Definition. Endoscopy allows identification of the source of bleeding as well as hemostatic treatment for actively bleeding lesion. Endoscopic hemostatic treatment of high-risk lesion stop bleeding and reduce the risk of further bleeding and the need for surgery. It is recommended that patients with acute upper gastrointestinal bleeding undergo endoscopy within 24 hours after gastroenterology consultation. The role of endoscopy performed within time frames shorter than 24 hours has not been adequately defined. Application in nursing. It is advisable to have enough personnel to carry out the endoscopy. Usually, a nurse will receive support from the endoscopist and another person will attend the administration of the sedation and the patient hemodynamic status. Receive the patient and monitor vital signs. Check that the patient or responsible family member assigned the consent to perform the examination. Pros and cons. Pros. An endoscopy can help the doctor determine if the patient has gastrointestinal bleeding, diagnose any disease in the esophagus, stomach, or duodenum, allow to stop bleeding by injecting drugs. Cons. There may be cases of perforation of the stomach, duodenum, or the esophagus, which may require surgery. Sometimes breathing difficulty, hypotension, or excessive sweating occur due to allergies to anesthesia or sedative. You can suffer side effects like sore throat or colic. Issue apply in Ecuador. In Ecuador, patients with acute upper gastrointestinal bleeding undergo endoscopy within 24 hours after the gastroenterological consultation. In Ecuador, the hospital with endoscopic areas have highly qualified medical and nursing personnel with a state-of-the-art technological infrastructure in a warm and human environment where procedures are carried out every day with the highest technological and safety standard for the patient. In conclusion, acute upper gastrointestinal bleeding is one of the most common medical emergencies. A national audit from the United Kingdom estimates accrued overall in-hospital mortality of 10% after acute upper gastrointestinal bleeding. Endoscopy allows identification of the source of bleeding as well as hemostatic treatment for actively bleeding lesions. Endoscopic hemostatic treatment of high-risk lesions stop bleeding and reduce the risk of further bleeding and the need for surgery. Thanks.